An unexpected discovery by scientists at Lund University has identified a novel tumor-killing complex which may revolutionize cancer treatment. Formed by naturally occurring molecules, the complex kills many different tumor cells, apparently without damaging healthy tissue.
We were doing an experiment to look for novel antibiotics, including bacteria and cancer cells. And we were trying to prevent the bacteria from infecting. And when we did so using a human milk fraction, the tumor cells died. And we were off suddenly on a tangent into a completely different project.
The active complex from mother's milk consists of a protein, alpha-lactalbumin, and a fatty acid, and has been named Hamlet as an acronym for human alpha-lactalbumin made lethal to tumor cells. In early studies, Hamlet showed effects in patients with bladder cancer, and this cancer type is now the focus for clinical trials.
We were interested in urinary tract infections and working with doctors who also treated patients with bladder cancer. And so the idea came up that maybe we could try this new molecule to see if the tumor cells responded.
And the effects of Hamlet on tumor cells are actually quite dramatic. In patients with a tumor, Hamlet is injected into the bladder via a catheter.
Hamlet is contacting the outside of the cell and then makes its way into the cell very quickly across the membrane. It also travels rapidly through the cell into the nucleus. And in the nucleus it accumulates again and makes sure that the machinery of the cell, which is necessary to keep the cell alive, is inhibited, is stopped.
The clinical studies carried out so far bring new hope for this large patient group.
It's one of the most common cancer forms we have. And if we just look at Europe, it's about 2 million people that actually suffers from urinary bladder cancer today. It's actually one of the most expensive cancer forms to treat. And the main reason for that is that these patients have to go to the hospital again.
Professor Marek Babiuk cannot hide his hope for more effective cancer treatments to help his patients in the future.
All patients will applaud any situation when the number of recurrences or the risk of recurrence after TURB will decrease, or which would be the best if we can prevent TURB or if we can destroy the tumor just with instillation, but we will see in the future.